this year's COVID-19 death toll in the U.S. is higher than last year's. New data from the CDC shows in total, the coronavirus has killed more than 770,000 Americans. Based on last year's figures, almost 15,000 more have died from COVID-19 in 2021 than in 2020. And this comes as cases and hospitalizations are on the rise again ahead of the holidays this week. Thanksgiving travel is expected to rebound to pre-pandemic levels. And earlier on CBS Mornings, the president's chief medical advisor, Dr. Anthony Fauci, urged families to remain cautious.
We've got to be careful. That doesn't mean we can't enjoy the holidays. We can be with our families. If you're vaccinated, great. Get boosted. We now know that boosters, you're eligible to be boosted if you're 18 years or older for the vaccines that have been available, the 2 mRNAs as well as J&J. Go out and get vaccinated. Children, in fact, 5 to 11 now, 28 million of them are eligible to be vaccinated.
Dr. Cioe-Peña is the Director of Global Health at Northwell Health and is joining us now to talk a little bit more about what we're seeing this year. So what kinds of cases are you seeing most within your hospital system?
Yeah, so good morning. It's really a mix of people who have unboosted vaccination that are very minimally sick or didn't know that they were sick, who are testing positive either through routine testing or just a very low threshold for testing to make sure that they don't pass it on to either a susceptible family member or somebody who's not eligible yet to be vaccinated. And then the majority of people that we're admitting to the hospitals, 99%, are unvaccinated Americans that are eligible to receive the vaccine but have chosen not to. And those really are the people that are at risk this holiday season.
So AAA predicts more than 53 million Americans will travel for the Thanksgiving holiday. What concerns you most about that? And what's your advice for families gathering? If some folks, we understand what it would mean if everyone is not vaccinated, but what if there are some folks who are vaccinated, fully vaccinated, and others who are not?
Well, I mean, the first take home is for those that are fully vaccinated, this really is a low stakes holiday season, much less low stakes than it was last Thanksgiving. The problem is that we are going to have Americans that are unvaccinated that are still going to travel and go to large groups, and they are at risk for severe disease. And that puts everybody at risk, not only because of the amount of intensity it takes for them to get through their hospitalization and course and the risk of death, but also the stress it puts on the healthcare system. And so what I've been telling people, especially when people go abroad, we just returned from a trip to Guyana, and Guyana's surging in COVID, and we're all vaccinated. But the point is that the healthcare system's overwhelmed. So if we have a heart attack or somebody gets hit by a car, there's a risk to those people because the healthcare system isn't at its peak and prime efficiency, and there's going to be risks of secondary issues. So, really the take-home message has to be, if you're eligible to get vaccinated, strongly consider getting vaccinated. It's obviously too late for the Thanksgiving season, but I think a combination of, judicious screening of symptoms and perhaps, these at-home antigen tests, using them right before you meet with loved ones, is a good strategy to prevent transmission.
So as you know, doctor, there are all sort of types of different vaccine mandates depending on what you do for a living, where you work, where you live. There's a federal workers vaccine mandate that and which requires federal workers to be fully vaccinated by today. Today's the deadline. We've been asking doctors now with the introduction of booster shots, what should we consider fully vaccinated? 2 shots or 3?
Yeah, that's a tough question. It's more of a policy question, really, than a medical one. The 2 shots definitely prevents you personally from having a severe outcome from COVID, assuming your immune system is working normally. The 3rd shot really boosts protection against transmission at all. So the difference between 3rd shot and 2nd shot really is your ability to pass on the virus to other people. And that only matters because so there are some people who have chosen not to get their 1st and 2nd shot. So my advice right now is let's focus, the people that want the 3rd shot because they want to be more protected and not transmit the virus, great, get it. But let's really focus on those 1st shots. We've got to get Americans that have been deferring this decision, or, I've met a lot of patients that have told me they're waiting for more information. We've got the information. Now's the time. Get the shot, get vaccinated, protect the country, protect your family.
So, Doctor, what are your thoughts on the language used by the CDC on booster shots? Is there a reason why it used the word may instead of should when recommending boosters for all adults?
Yeah, I mean, remember that the final result or the purpose of a vaccine is really to prevent what we're, hospitalization and death and severe disease. So we the real goal of any vaccine is to make sure that if you get the virus, if you get any virus, that you don't have a severe outcome, that you don't need to seek health care, you can rest at home. That really is the primary endpoint for almost every vaccine that we use. And then what happens is, as everybody gets vaccinated, the numbers of cases just naturally drop because we've gotten to, what's called herd immunity. The issue with the third shot is that that's boosting our immunity and preventing us from, even though we're seeing high prevalence still, people who have 3 shots are still very, very unlikely, like greater than 90% chance of not getting infected with COVID and not passing it on asymptomatically to other people. That really only matters right now because we're in a pandemic and because the prevalence is high. So I don't think that the third shot really should be the rule. It should be the exception. And the reason why we're going to third shots right now is we've got 2 camps. We've got people who are very hesitant about getting even 1 shot. And then we've got another camp that wants the most protection they possibly could have to protect them and their family. And so we're seeing this dichotomy of people getting 3 shots or 0 shots. But, the problem would get fixed if just everybody got the 2 shots.
So apparently we're seeing increases when it comes to older people, in terms of new cases when it comes to older people and people who already have underlying conditions. Any idea why we would see those people? Obviously, these are the more vulnerable people in our society, but why we're seeing an uptick in cases among them?
Probably because they were the first to get vaccinated in the rollout plan, and so they're likely time-wise to have the longest time horizon from when they got their first dose. Most people who are over 65 got their first dose sometime in January or February, so they've really had the longest amount of time to have waning immunity from that, like I said, absolute protection from the vaccine. Now we're still seeing much better outcomes in older Americans that are vaccinated with the 2 doses. Obviously, there's a real compelling case for them to get the third shot because they can get pretty sick even with 2 shots of vaccine. But again, we wouldn't have the numbers we have now if it were just the elderly that had received 2 doses. This is the American country right now. We face an unvaccinated problem. And that really, I can't put too fine a point on that. We would be having a totally different holiday if everyone got the shot when they were eligible this past year.
So I just want to get some clarification from you, because when we talked about the booster shot, you said, the main thing that the booster shot does is diminishes your ability to pass the virus on to other people. I think part of what we've all assumed is that, 6 months after your second shot, your protection begins to wane. And so what the booster shot does is give you a boost in terms of your protection. So you go from, I don't know what the number is now, like 60% to like back up to 90%. So I'm kind of curious as to kind of which one is it, or is it both? What exactly is the purpose of the booster shot for somebody like me who's, basically healthy and fully vaccinated?
Yeah, it's a great question. And honestly, it is both. So, you have these cells called B cells and T cells that are memory cells that even once your antibody levels to the vaccine start to drop, those cells are going to remember that virus. So it won't protect you from getting COVID again. But once you get reinfected with COVID, they're going to ramp up very, very quickly to fight that infection. And that's where you get the secondary benefit of just preventing hospitalization, death, or severe disease. So you're still able to pass it on, but your memory cells will make it so that your disease is pretty mild. Now, obviously, in older Americans, pretty mild can turn into moderate disease or more severe disease, but we haven't seen, like I said, a lot of severe requiring hospitalization or death. And even among the hospitalized elderly, we're seeing a less sick cohort of people getting hospitalized when they've been vaccinated. So that's a good sign, because I remember that hospitalization number can move back and forth in terms of severity. It's not very objective. The second thing I would say is that third shot both improves your memory cells, so it cements more into memory. So it does help with the secondary effects. But the more important thing that it does is it boosts that antibody level back up, so that if you get exposed to coronavirus, you're now going to neutralize it before it has the chance to infect you, before you can become a minimally symptomatic or asymptomatic carrier and pass it on to other people. So it's really working on your entire immune system. But the main benefit is getting those antibody levels back up.
All right, Doctor.
All right.
Sorry, Anne-Marie, did you have a follow-up?
No, I'm good. Sorry, Vlad.
That's okay. It's all good. It's all good. Doctor, it's always great to see you. If we don't get a chance to talk to you before the holiday, happy Thanksgiving to you and yours.
You as well. Take care. Thanks.
Thank you.